Welcome back. Well, folks, I never, ever, ever like to be the I told you so guy. But I'm pretty sure in this case, I'm completely justified. Before I make the statement, let me just say this. How many people have died from COVID because of power-hungry, I want to be rich bureaucrats like Fauci and others in D.C.? And how and why do I make that statement? Well, because these are the folks who kept life-saving drugs from getting into the hands of sick Americans. So how many? How many have to die? How many have died? 1,000? 10,000? Hundreds of thousands? I don't know. We'll probably never know. But we do know, and it's a fact, government agencies at the federal level and some state level are to blame. They're to blame for not allowing Americans all kinds of treatments. Monoclonal antibody treatments. How about that one? We know they work. Ivermectin, hydroxychloroquine. Yeah, these treatments work. They can effectively treat COVID. Now, do you recall all the negative press about these treatments? So I should probably throw the press in there. They were claiming that, oh gosh, don't take that one. It's a horse dewormer, ivermectin. Oh, there's people out there in Arizona ingesting pool chlorine when Trump said hydroxychloroquine. Remember that one? And people died because you lied. I'm talking to CNN, MSNBC, Fauci, Biden, Democrat governors, guys behind the counter at CVS's that refuse to fill prescriptions. All of you damn liars and fools, you have blood on your hands. You let Americans die so Big Pharma could get rich and the Washington elite could gain more control over the American people. Good job. Hope you all sleep well at night. I say this because it brings me back to the beginning of my statement. I told you so. Ready? Medical researchers, and now, finally, stepping up to the plate and saying what? That they're ready to use these life-saving drugs to treat COVID. Put the headlines up. It's out now. Now, if you notice, these are local news affiliates covering it, none of the big boys, because they would have egg and blood all over their face. Ivermectin. In UVA Health study, possible COVID-19 treatment. UVA Health to test ivermectin, other drugs as 19 treatments. UVA participates in study to test controversial ivermectin. And then look at that last one, could have a huge global impact. The University of Virginia Healthy System will join nationwide study to evaluate 2 drugs. And I'll ask the doc coming up here if I'm getting this right, fluvoxamine and ivermectin. I might have got the first one wrong. Possible medications to treat COVID cases. What has this network, what have others been telling you? What have doctors brave enough to speak up have been telling you? These things work. The UVA Health System will now test participants who are at least 30 years or older and have tested positive for COVID within the past 10 days. Now, they must have had at least 2 COVID symptoms for at least 7 days to be part of this study group. But do you see? Now they're going to look into it. They know the results. They know these things work. How much death do you have on your hands? My next guest, cardiologist Dr. Peter McCullough, has been saying things that we've been saying on this network, that there's other effective treatment for COVID. Again, we've been reporting it now for, over a year and a half. Dr. McCullough recently tweeted out, ITECH, another small underpowered RCT, given very late, only 26%, received steroids besides the biased physician-assigned primary endpoint, the unbiased meaningful events, mechanical ventilation, and death, all numerically lower with widely used anti-ineffective, adds to body of positive data. And then he's got the charts there proving efficacy of ivermectin. Again, folks, remember, Trump brought up hydroxychloroquine in the summer after all this broke out. Remember, it broke out in March? We started locking down of 2020. He says hydroxy in the summer. Oh, they nailed him for that. Later in the fall, he talks about ivermectin. They nail him for that. And everybody tells us, don't touch it. This could kill you. These are for horses. This is for your pool. Lies. Let's bring Dr. McCullough back onto the program, someone who actually tells the truth about this whole plandemic. Peter, nice to see you again. I'm so glad to see that mainstream major university hospitals and scientists and virologists are now looking into the efficacy of using all of this over-the-counter stuff that's been around for 50, 60, 70 years. how long have you and I been sitting here saying this?
Dan, they're 2 years too late, but to clarify, ivermectin is prescription. It's not over-the-counter, although we do use other over-the-counter medicines. The reason why I tweeted out about that ITECH study published in JAMA is contextual. And JAMA is the journal of the American Medical Association, and the American Medical Association in September announced a campaign to abolish the use of ivermectin, abolish the use. They published this study from Malaysia. It's a small randomized trial. It's not blinded. The physicians assign the primary endpoint, so we have to discount it since the doctors decide how much oxygen the patient gets. But when we look at the things that are hard endpoints, did the patient end up in the ICU, on the ventilator, or die? It is a straight flush for ivermectin. Ivermectin reduced ICU stays, mechanical ventilation, and mortality by a considerable amount, small numbers, but it's another positive study, Dan. It was spun as a neutral study for ivermectin. In a sense, someone emailed me and said, aha, this is it. This is the death knell to ivermectin. I looked in the table. I said, wait a minute. Ivermectin is helping people just like it always has.
You know, Doc, when I see these reports continuously coming out and you're hearing about them studying like a pill that they might put out, Johnson & Johnson or whatever Moderna's doing, whatever all these drug companies are coming up with. And now they're looking into all this different stuff that we've been discussing. Dr. Brian Tyson, who's been on the program, all these different doctors who've had the guts to come on and say stuff on this network and elsewhere about these drugs that have nothing to do with the vaccine. It just makes me say, I know Americans, people around the globe died because we didn't look into these when people like President Trump and other brave doctors like yourselves were saying this almost 2 years ago. My daughter lost her grandfather on her mother's side. Great man. Hospital wouldn't let him try anything. I firmly believe Americans died because big pharma and bureaucrats stopped people from trying these drugs. Am I fair in that assessment? I know it's a harsh one for a doctor to agree with.
I told Tucker Carlson. No, Dan, I agree with you. I've looked at the data. I've told Tucker Carlson this as well. I've looked through all of the published studies. When we look at patients dying with COVID-19, we always see a lack of treatment. No mention of early treatment. No mention of pre-hospital therapy. You know, in a paper by Chow and colleagues, the National Institutes of Health on the ResearchGate preprint server, the first autopsy study by the US NIH, interestingly, the patients had 9 days before they came into the hospital. No mention of early treatment. They all die with the virus. And I can tell you, Dan, it's clear that we should have always taken the precautionary principle. That is, treat with the best drugs we have at hand, with the signal of benefit, acceptable safety. And if better drugs come along in the future, fine. But there shouldn't be another high-risk American who's denied early treatment. It is contributing to a massive number of avoidable deaths.
Yes, and that's exactly what happened to my kiddo's grandpa. And I've heard it from I don't know how many people. Stay home, the hospital told him in 20 and 21. Stay home, stay home. Oh, now you're so bad, we got to get the ambulance involved. Okay, come on in. Oh, we got to vent you. No pre-treatment, nothing at home. None of these drugs they could have got a script for. This is what drives me insane. I want to switch to masks real quick because this one's making the rounds all over social media. And of course, there's tons of conspiracy theories about Bill Gates' involvement in the vaccine. And I'm not going to go there with that stuff. I'm just going to show the hypocrisy. But first, I want to show you this picture. This is what an 8th grader in New York drew about the masks. Look how their hands covering her face while she cries. What we are continuing doing to our children, Dr. McCullough, is disgusting. And I want to roll this soundbite from Bill Gates while he sits on a stage with no mask and jokes about what's the big problem with all of us and our kids having to still wear masks. Well, none of us are wearing them anymore because most all the states are removing them, but not for our children. Listen to this, and then I want to get your reaction before we head out with you, Doc.
What is the downside of wearing a mask? I mean, it's got to be tough. You know, you have to wear pants. I mean, this is tough stuff. These societies are so cruel. Why do they make you wear pants? I'm trying to figure it out.
We're very glad you have yours on.
Yeah, what's the big deal with wearing masks? Oh, it's so hard wearing masks because it's psychologically, physically, mentally hurting our children. and yet you have tyrants not taking them off. I just wanted your feeling now with all the new data on masks and cloth masks not working. Should we still be masking anyone, especially the kids, Doc?
No, all the mandates for public masking should be dropped, should have been dropped a long time ago. Dr. Mark McDonald in the United States of Fear, his book outlines really the harm that's been done to children, including public masking. Vaccines and masks in children, Dan, are effectively trying to use the children as human shields to adults. And the social media is full of pictures where the poor children are masks, but the adults are going without masks, picture after picture. I think historians will record the unusual cruelty towards our children. They've really been the victims of the COVID-19 pandemic. Masks off everyone. And I think doctors, nurses, dental hygienists, and others wearing masks as we normally do is fine, but no public masking.
Yes, thank you. Dr. Peter McCullough, cardiologist, host of the McCullough Report. Always a pleasure to have you on the program. I'm sure you got to get back to work, saving lives. Take care, Doc. Thank you.